Before I did any motion palpation on any regions of the spine, I would do static palpation to look for any edema or swelling around certain segments, as well as inspection for each area to look for any swelling that's visible or any redness, lesions, scars, moles, anything like that. For motion palpation of the occiput, we use the jaw jut, so I'm going to be contacting on both sides of the head around the ears and my thumbs on the back of the occiput, and I'm going to be rotating him to each side and jaw jutting him forward. If he has any decrease in motion to either side whenever I'm jutting the jaw forward, then this would indicate a fixation of that side with occiput. So I'm going to have you sit up nice and tall. I'm going to contact on each side of the head and behind the occiput. I'm going to rotate him to the right and jaw jut him forward. I'm going to rotate to the left and jaw jut him forward. If he had, for example, a restriction of the jaw going forward with right rotation, then this would indicate a right occiput fixation. The next thing that I'm going to do is motion palpation of the SI joints. So I'm going to have you stand up in front of the table, please. I'm going to come around and stand behind you. I'm going to contact PSIS and S2 for the upper boot. Can you raise this leg for me? And this leg. With ipsilateral leg flexion, I'm looking for the PSIS to drop posterior and inferior. And with contralateral leg flexion, I'm looking for my S2 thumb to drop inferior. And for lower boot, I'm moving down to PIIS and S4. Can you do this leg, please? And this leg. Okay, and I'm going to move over to the other side so that I am motion palpating bilaterally to compare. Can you go ahead and raise this leg? And this leg? And I'm going to go, that was PSIS and S2. I'm going to go down to PIIS and S4. And I'm going to have you raise this leg and this leg. If there was any decrease in motion or fixation during the 8-point check, this would give me a specific side SI joint to focus on and further analyze. I can further analyze using a gluteal fold height. So I would come up the back of the legs to look at the height of each gluteal fold. I could also check for edema around the SI joints. Edema above the SI joint would correlate with a PI listing. Edema below the SI joint would indicate an AES listing. For IN and PX components of a listing, I can look at gluteal width. A narrow gluteal width would indicate an IN, and a wide gluteal width would indicate an EX. For a right knee, I'm going to have you lay on your back on the table for me. For the knee, I would do basic active range of motion beforehand just to make sure that they can do the movements and to check for any restriction in specific ranges of motion. For motion palpation of the right knee, I'm just going to make sure that he doesn't have any pain upon static palpation. Do you have any pain?
No, I do not.
Okay, so I'm going to bring the leg out and about 30 degrees of flexion. I'm going to place his leg between my legs. I'm going to use a bimanual grasp web contact on each side of the knee. I'm going to do the knee wobble. So I'm going to bring the knee laterally, neutral, and medially. I'm going to do this until I feel if there is a restriction in going either lateral or medial. This would indicate a lateral or medial tibial plateau. If he did not want to go lateral, then I would bring him into the lateral position, drop my elbow, and my line of correction would be medial to lateral to restore lateral motion.